Hey there, I'm Molly and I'm one of the people who perform NIPTs at London Pregnancy Clinic. Today I wanted to chat with you about how we go about doing them. Firstly, let's talk about NIPT or Non-Invasive Prenatal Testing. It's a screening test that helps us assess the risk of common chromosomal conditions in your baby. How does it work? Well, we take a little blood sample from you, just like any regular blood test, usually starting from around 10 weeks of gestation. After collecting this, we send it to a laboratory using a courier system for it to be analysed. In the lab, scientists use the sample to isolate the baby's cell-free DNA or cfDNA from the plasma. Once the cfDNA is extracted, we prepare it for analysis using advanced genetic technology such as next-generation sequencing or NGS. This technology allows us to study the genetic material in detail and detect any potential chromosomal abnormalities. Once the analysis is complete, the test results are typically sent to your healthcare provider within a few days, depending on the partner lab's location. It's important to note that NIPT is a screening test, not a diagnostic one. A positive result doesn't necessarily indicate a condition, it simply suggests a higher risk. Your healthcare provider may then recommend further diagnostic testing, likely invasive, to confirm positive findings. I hope this overview of non-invasive prenatal testing has provided you with valuable insights into this important screening procedure. Remember, if you have any questions or would like to schedule an appointment, please don't hesitate to get in contact.